The segment is sponsored by Coastal Wound Care, helping patients achieve optimal healing and recovery. Coastal Wound Care now has a second location. We'll talk about that in just a moment. Dr. Timothy Gregory, along with Nurse Vera Dejikova, are here with much more. Good to have you back on the show.
Great to be here.
Bringing Vera with you as well today. That is fabulous. What types of wounds do you folks treat?
So we treat any wound basically head to toe, and common wounds would be anything from a pressure ulcer or a bed sore to post-surgical wounds that you have surgery and then afterwards, unfortunately, if things don't go well, that can break open. But some of the most common ones would be venous leg ulcers from insufficient venous insufficiency, where you get kind of swollen legs and you get these wounds on your legs. And then probably the most common would be diabetic foot ulcers, which is very, very prevalent, especially here in the Charleston area.
Wow, and you folks taking care of that can help a lot with the person that's diabetic, right?
That's right. You know, when they come in, we do a complete assessment, and you know, what we're really trying to do is obviously get the diabetic foot ulcer healed, but really, you know, the secondary thing we're doing is trying to prevent amputation, because once a diabetic has an ulcer on their foot, their risk of amputation is much higher than the general population.
When you say that word amputation, it sparks people's minds. That's really serious stuff now.
It's very serious stuff, especially since, you know, once a diabetic has a below-knee amputation, their survival rate goes down quite significantly in the 3 and 5 year window.
When should a patient be seen at a wound center versus the primary care provider? The difference, the two there.
Sure. You know, generally speaking, if you have a wound, even if it were you're a diabetic with a foot ulcer, you can certainly initially see your primary care provider if you wish. And, you know, some primary care doctors are comfortable treating it to a certain degree. Some are not.
Right.
But I would say, generally speaking, number one, you can always come to Coastal Wound Care immediately. You don't need a referral, with a few exceptions. And then the other thing I'd say is, if you've had a wound that's been treated by a doctor for 4 weeks or more, and you're not really seeing any progress, you really need to call us.
Wow. I think that's the big words, if you haven't seen any progress.
That's right.
Yeah, that's coming up. Vera, what can a patient expect on their first visit to Coastal Wound Care?
Okay, so patients come, of course, they're greeted by the front desk, and then they go to the patient room, and before doctor come, we do like an assessment. We take a picture of a wound, we speak to the patient, we ask like what the main problem is, how long they had this wound, if they have diabetes, if they're smoking, all these factors which can contribute to the wound development, and understand why the wound is not healing. If needed, we do the blood work, checking the A1C. We also can do like the ABI, so we're checking the blood flow to the legs and see if like the blood flow is compromised. We take a picture of the wound. Of course, we also do like vital signs and ask all the questions and clean the wound. And when patient is ready, then we ask the doctor to come and take care of it.
Take a look at it. Wow, there's a lot of nice steps that are involved there to make sure that that patient is taken very good care of.
It is. We do a very thorough evaluation on your first visit, and that sets the course for the rest of your treatment plan. And you know, we try to get right on it and get that wound healed as fast as we can.
And as you mentioned, you do not have to have a referral to come in and to see you folks.
You do not. There are some people who have an HMO insurance. Sometimes they need a referral. There are some exceptions, but generally speaking, most insurance, you can just call us and get in to be seen.
Exciting news! You've got a second location. Where's that?
We do. We have our second location opened a little over 6 months ago. It is in North Charleston off of Dorchester Road. It's called Netherby Lane, and it is about a mile past the Ashley Phosphate Dorchester Road intersection heading towards Somerville.
Very good. Thank you both for coming in today. Some really great information for a lot of people that are watching that can help them out very much so.
Well, thank you for having us.
Thank you so very much. And by the way, they're accepting new patients at their second location as well. We got more Lowcountry Live right after this.